I'll be talking about data in healthcare. And why should we care? Why should everyone sitting in this room care about data? I'll talk with a story in 2014 when Russia invaded Ukraine and annexed a part of it that it claimed belonged to it and annexed it and started to rule it as part of Russian territory. And the area that we know is called Crimea. And it is probably the success in 2014 that led to the latest escalation between Russia and Ukraine that we are still witnessing today and has taken thousands of lives in this conflict. But this is not the first time that such a conflict existed in this area. Exactly 170 years ago, in 1854, there was a similar situation around the same area. The then Russian Empire wanted to extend its influence to the area that is Ukraine and Romania today. And there were numerous battles that were fought. Thousands of soldiers died or were wounded. And when war ravages, people get wounded, people die, you need health care. We need hospitals for rehabilitation. We need hospital to treat the wounded. And that is exactly what happened back then too. The British injured were brought to a city in the closest region to the Ottoman Empire, and there were hospitals where those soldiers were treated. The British government was responsible for the treatment of those hospitals, so they sent over a data scientist to that hospital. And what that data scientist did was to look at what was going on in that hospital. She looked at the reasons for the patient's death in that hospital. She looked at the sanitary conditions in those hospitals. She looked at the diet that was given to the patients in that hospital. And what she found out was that it was not the battle wounds that were killing most of the patients in those hospitals. Those were the non-communicable diseases that was resulting into the majority of deaths in those hospitals. The lady is known as the lady with a lamp. And she has a very important role in the healthcare history. She revolutionized the way we looked at the way treatment is given in hospitals. And surprise, surprise, she got resistance based on her ideas. How can she come and tell us that it is our practices that is resulting into the deaths of the patients and it is not the disease that is happening? She was brushed aside that no, we do not believe in what you're saying. Is it that you're saying that not washing hands is causing the deaths? You're telling us that we are not providing the food and that is resulting in the deaths of the patients? We do not believe in you. But she was persistent. She was persistent and she used modern tools. She used visualizations. She used charts to present her view to all and everyone who mattered. This is a modified image of an actual chart that she made and presented to the higher-ups so that she can prove a point through data that the deaths are not caused by more deaths are not caused by the battle wounds, but by non-communicable diseases. And she persisted and she prevailed. We know this data scientist as Florence Nightingale in the history of medicine. It was her groundbreaking work that resulted into royal commissions being formed afterwards. Her work resulted into change in practices in British hospitals. And all her work was based on data. She observed, she collected data, she analyzed the data, she presented the data, and she made changes based on the data. And her work inspired change in the way people thought about practice of medicine. Of course, she was not the only one. In the history of medicine, whether it is Islamic medicine, whether it is Chinese medicine, it has always been rooted in data. But Florence Nightingale's examples show us that if we use data in an appropriate way, data scientists can actually save lives. So we have a cliche. We say that data is all around us. If you just look around in this hall and we want to collect data, there are so many data points that we can collect. So there are hundreds and thousands of data points that if we want to collect, we can collect. But do we really need to? What is the benefit of collecting that data? That is the real question. So the phone that we are using and not listening to what's going on, that data is still being collected. Most likely, we are either on Instagram or Facebook or some other social media site, and they are collecting the data on what behaviors we are exhibiting on their platform. So social media is constantly collecting data on the way we interact with it. The likes that we make, the posts that we make, the pictures, the videos that we share, all the data is being collected and constantly analyzed and profiled on how we behave and how we interact. A lot of us use, and I hope not right now, use online shopping sites. And we shop. And we go and we click on products and not necessarily buy them. But that data is still mined. It is still collected and it is still useful. And sometimes you would notice we get emails in our inboxes that you left something in your shopping cart. Would you like to proceed and purchase it? It is because that data is collected, it is mined, and it is put to an actual use. That is where the actual benefit of the data is coming out of it. The amount of data is humongous. There is a statistics that says that 90% of the data in this world was created in the last 2 years. There's another way of looking at it. What this means is that the amount of data that exists in this world is doubled every 2 years. And when we are doubling it, you can just imagine what the situation would be in a few years down the road. So what it means is that right now in this hall, it's not a hall where people are sitting here and listening to a lecture. This is actually an oil field. Because there is another cliche that data is the new oil. So when we say data is the new oil, what do we mean by that? We mean that that oil drives economies. So we all know that oil-rich countries are one of the richest countries in the world. Countries in the Middle East, they are rich today because they have a natural resource that God gifted to them, and they are able to utilize on that. So oil drives economy. So does data. But then it is not just the presence of the oil that drives value coming out of it. We do know that there are countries, they have oil, but they are not able to get benefit out of it. Because like oil, when you discover it, you get it from the ground, you have to process it. You have to get it through a certain a refinery for it to be able to get value out of it. So if we have data available to us, but we don't have data refinery available to us, we would not be able to get value out of it. So the more we refine oil, the better outcome the better economic outcome we get out of it. The same holds true for data. So if we collect all the data from this hall that we just talked about on the number of people, on the attention span, on the gender and everything, but we do not refine it, we do not make use of it, it's of no use. So that is the analogy. That is why we say that data is the new oil. We may be rich in having oil, but if we don't know how to use it, then we will not be able to get economic benefit out of it. So if we imagine, and a lot of us, either ourselves or through our family members or through our studies, would have seen how patients encounter with their doctors in the clinic. So anyone who goes into a clinic would first probably get themselves registered. And when they get registered, they would provide some information. They would give their name, their address, their phone number, where they're coming from. So we would be collecting demographic information from them. Then probably we would go and have some sort of an initial assessment done. And we would be collecting clinical information and maybe social information, some in much more depth, and collecting that information from the patient again. And then when the patient is interacting with the doctor, then some more information is collected. and some more information is created. Because now we have created data about what the course of action for this patient probably would be. Then we go to pharmacy to buy medicine. We are creating data. We're creating more data. How would you like to pay for it? Do you have any insurance for it? Do you want to get medicine for a month, or do you want to get it for 3 months? So more data is created. And if we go and have our lab tests done, or if you want to get an X-ray done, even more data is created and captured in this process. So at an estimate, we have about 150 to 200 data points created from one patient to doctor encounter in just one encounter. So now that imagine how many patient encounters we have every day, and how many encounters do we have every month, and how many encounters do we have every year. So what do we do with this oil that is generated and that is created? We let it go down the drain. And by the way, we should not put oil down the drain. It clogs the pipes. So the data is created, the oil is generated, but we don't make use out of it. Why? Because at worst, we do not even capture it and write it down on the paper. We just get that information verbally, we communicate it verbally, we go home, and we don't know and we don't care what happened to the data. Or a little better, maybe we just put it down on a piece of paper and just, we don't make use of it. Over the years, we have evolved in healthcare on how we capture and how we make use of the data. In the previous times, we used to have paper-based medical records, and we hope that either God or pharmacist would understand what is written in there, to where we now have electronic health records, where data is collected electronically. But then again, if we look at the healthcare system around us, unfortunately, in majority of the cases, we're still lying on that part where the data is captured on paper. And we know the administrative overheads that is there to retain those paper-based records, the administrative overhead that remains if you want to get value out of it. So we're not making use of that oil. On the electronic side, it again is not a silver bullet. We may have the best electronic medical records in the world, but if people are not using it, it is of no use. Even if people are using it, but we don't know how to make use of it, how to generate the value out of that oil that is being generated on an annual basis, it still is not the maximum value that we are generating out of it. So how is it useful? So when we say we are not generating value out of it, how is this data, if we assume that we are collecting it diligently in electronic form and we want to make use of it, how can it be useful? It is useful for prediction. We all know the buzzword artificial intelligence that is going around these days, but there are actually models out there put into practice, put into production, where when information is fed to a properly defined model, it would give you predictions. It would predict about the condition of a patient. It would predict any outbreak that may happen in any part of the country or the world. It can predict how a patient is going to respond to a particular therapy. So that would be one way of making use of the data. Another use case for the data would be that we make it to personalize the care for the patient. If we have genomic data available to us, the world is moving into the direction where we have personalized medication based on the data for the genomics of the individuals that we have. We can make use of the data for increasing the efficiency of the healthcare systems that is already burdened, whether it is private or public. It can give us predictions, it can give us insight on how many patients come in on a particular day, how many patients come in at a particular time, and we can make our resources available to those patients accordingly. And the last but not the least, the population health. If we have sufficient data available to us, we can identify where the problems are, which unfortunately are a lot that Dr. Zafar just talked about. But we can make use of the data to make sure that the resources, the meager resources that are available to us could be targeted in those areas where we are able to make the maximum benefit out of it. So why should we, sitting in this room, care about the benefit of data that is out there? We have approximately 280 million data sources in this country. And this, by the way, is the 5th largest reservoir of, shouldn't say oil, but data in the world at the moment. So what is our disadvantage can be converted into an advantage. All the AI models out there have their basis in data. If you don't have data, you can't have AI models. And AI models need to be trained on a regular basis. So this amount of data sources, there are very few countries in the world that can make use of it. So all the negatives that we have out there, yes, we need to address them. But if we start to collect data in a manner that we can create models out of it, this is the amount of oil that we are sitting on at the moment. So what should we do sitting right here? What does it mean for us? Like Dr. Zafar said, we need to start from here. We need to change our lens, the way we see things, the way we interact with all the systems that we are interacting with. We need to change that. Whether we are students, whether we are healthcare workers, whether we are members of general public, we have our own roles to play in this data landscape on making use of this oil that is out there. For students, if we chose any field in healthcare because we did not like technology or maths, tough luck. We have to learn all these things again. This is something that we would not be able to escape in the futures to come. There would be a lot of job roles that would not exist 10 years from today. So what we need to do is we need to train ourselves to unlearn and learn on a regular basis. We need to look at things on the interactions that we do with our health systems, the kind of data that it is generating. So we need to change our lens. For healthcare providers, we need to embrace technologies. We need to embrace our devices, wearable devices, because they generate a lot of health insights. And then invest in systems where we can convert this raw data into insights, into actions, into predictable models, so we can derive the maximum value out of it. And members of the general public participating in different trials and data endeavors that are out there. So all of us, we need to come together, we need to prepare, and we need to embrace for the future. I thank you very much.